Hi, I'm Dr. Mikey Goldwire, and I will be your instructor for PDRO 7200 Fundamentals of Drug Information. The syllabus is posted in the Canvas shell, but briefly I'd like to go over the objectives of this course. To demonstrate effective written and oral communication skills, to demonstrate proficiency in the use of computer-based medical information databases, to construct and execute a systematic search using primary, secondary, and tertiary biomedical literature, to discuss the merits of primary, secondary, and tertiary biomedical literature, and to explain the results of biomedical literature search to healthcare professionals and the lay public. This course will provide you with the skills needed to effectively and efficiently answer drug information questions. And hopefully a lot of it is a review for you. Specifically, I would like you to learn the advantages and disadvantages of primary, secondary, and tertiary literature, and also how to systematically search the literature and answer drug information questions. The course is divided into 4 lessons. The first lesson, I will provide an overview of drug information sources, primary, secondary, and tertiary, that are available to you at the University of Colorado Health Science Library. In Lesson 2, I will review the systematic approach to answering drug information questions and the use of tertiary resources. This lesson will stress the importance of background questions and getting the appropriate information you need to adequately answer the drug information question for the requester. Lesson 3, we will review searching using primary and secondary resources. And lastly, in Lesson 4, we will review useful internet sites. The assessments for this course will be mainly answering drug information questions. I'd like you to use the library resources, and I'd like you to submit these questions using the correct language for the requester, whether or not the requester is a physician, a healthcare provider, or a patient. You will participate in weekly discussion forums, and at the end of the 4 lessons, you will have a quiz. Please don't hesitate to contact me through the Canvas page, through my email, michaeline.goldwire@ucdenver.edu, and also my cell phone for emergencies or any extenuating circumstances that come up. I can be reached at 303-888-8663. This course is divided into 4 lessons, in which I will provide you the necessary information to effectively and efficiently answer drug information questions. Specifically, the advantages and disadvantages of primary, secondary, and tertiary literature. You will also learn the systematic approach to answering drug information questions and searching the biomedical literature. The first lesson is an overview of drug information sources, including primary, secondary, and tertiary resources that are available to you at the University of Colorado Health Science Library. The second lesson, we will discuss the systematic approach to answering drug information questions and tertiary resources. The third lesson, I will provide you with the basics of Medline searching and a review of the primary and secondary literature. And lastly, we will end with useful internet sites. So let's get started. The objectives of Lesson 1 are to describe the practice of drug information, describe the hierarchy of medical literature, describe the Denison Medical Library site and the resources available to you, and to provide a brief overview of available drug databases. So, when you're answering drug information questions, you need to know your resources. You need to know what's available to you, and you need to know which resource to go to answer your question. You also need to critically analyze the information that you find. You need to obtain accurate and thorough patient background information. Often, if you don't obtain enough patient information, you find yourself calling back the requester. You will formulate a clear and concise, accurate, unbiased answer, and then you will communicate the answer to the requester. So a lot of what I want to go over with you in these 4 lessons is I want to make you aware of what resources are available to you through the medical library. I suggest that you bookmark the library site, which is http://hslibrary.ucdenver.edu. Let's go visit the library site. So the first thing you see with the library site is a section off here to the left, which is top resources. I use a lot of the clinical tools here. And you see in the clinical tools section, you have Dynamed, MD Consult up to date. And I also use the pharmacy information down here, Access Pharmacy, Micromedics, Natural Medicines, and Pharmacy Library. The library site will be adding LexiComp and facts and comparisons to this pharmacy section. I have a URL for those for the lesson today, but I would lead you to this pharmacy section here to use the drug databases. You will also find tabs up here at the top. Find it. I don't usually use this because it searches the entire system or database, but there's a tab here to PubMed, to the journals if you know exactly what journal name you want to go to, Google Scholar, and then LibGuides. Just a brief overview on LibGuides. If we type in a research topic like pharmacy, you'll see that a pharmacy research portal comes up. These are called LibGuides, and these were developed by the librarians. So you can see here under the pharmacy one, there's a survival guide. Tells you a little bit more again about the library. There's a tab on finding articles, which lets how to searches for PubMed and also for the Find It. The books, again, for electronic books and other books, for societies, professional groups, top journals within the pharmacy school that you may be interested in, and also suggested websites. To get back to the home, you just click up here to the left, Health Science Library. So today I will be going over some of these clinical tools with you and some of the drug databases. So hopefully this is a review for you, but there is a hierarchy of literature. There are tertiary literature sources, and in these sources we find a compilation of the primary literature. So tertiary literature includes textbooks and online databases. There are secondary literature sources which help you to locate the primary literature. Secondary sources include Medline and EBSCOhost, and then there's primary literature, which includes original research. So with primary literature, what you need to keep in mind, this only includes original research. Review articles, editorials, policy statements, and clinical practice guidelines are not considered primary literature. Here I have a few examples for you: the New England Journal of Medicine, American Journal of Health System Pharmacy, and JAMA, the Journal of the American Medical Association. So again, although most people think of journal articles as primary literature, only original research is considered primary literature. When we read a journal article, we need to take some things into consideration. We need to evaluate whether or not the article was published in a peer-reviewed journal. We can evaluate the journal's reputation and impact factor, and the source of funding. We can also dig deeper when specifically reading original studies. We can look at the methodology, the clinical relevance, and patient populations. You will be learning more about the appropriate way to read primary literature in your literature evaluation section, which is coming up later this semester. Now, there are advantages to use of primary literature. A large advantage to the primary literature is this is the most currently published data. There is also a tremendous range of information. You can find journal articles on almost any subject. And you can personally assess the utility or validity of the information. The disadvantages of using primary literature is there's a lot of primary literature. You need to make sure that you search all of the articles that would be able to help you answer your question. You also need to take time to read the articles and interpret the results. And then remember that this is original journal articles or original research, so you don't have opinions by other experts. Here's an example of a journal article I just pulled from Annals of Pharmacotherapy. The effect of anticholinergic medications on falls, fracture risk, and bone mineral density over a 10-year period. And you can see that original research is generally organized in an abstract is written first, with the background, objectives, methods, results, and conclusions given. And then the paper follows in the same formatting with the background, objective, methods, results, and conclusions. And after the conclusions, you'll often have a discussion section in which the authors provide you with their thoughts on the research. So again, the primary literature has a standard formatting for writing, and it's a summary of the article, the abstract. It's generally divided into 4 parts: a background, method, results, and conclusion. You should never use just an abstract as a resource to answer a drug information question. The abstract provides information that the authors give. It does not provide all the details of the study. When you find an abstract that you find is interesting, you will need to pull the original article and assess the validity of that article to see if you can use the information to answer your drug information question. Secondary literature guides you to the primary literature, and these include indexing and abstracting services. Indexing services contain bibliographic information only, whereas abstracting services contain bibliographic citation plus a brief summary of the article, which is generally the abstract. Almost all secondary literature sources are electronic. Advantages of secondary literature: it can construct searches for you to find specific information. It also provides current citation information. Disadvantages: you have to learn how to use each of the systems, and you need more expertise than you do to assess a primary or tertiary source. You must filter through all the citations you find to determine whether or not those citations would be relevant to your search. Then you must track down original articles and read those articles before compiling your answer. Examples of secondary resources include PubMed, Medline, Cochrane Database, Google Scholar, ClinAlert, Embase, International Pharmaceutical Abstracts, Iowa Drug Information Systems, Journal Watch, and LexisNexis. I will only be reviewing with you Medline and Google Scholar. The library does have for you to access the Cochrane database and Embase. And Embase is more like a worldwide PubMed, if you want to think of it like that. International Pharmaceutical Abstracts and Iowa Drug Information System are specific to pharmacy literature, and they also contain medical literature, but the library does not have a subscription to those services. The contents of the secondary sources each has its own criteria for what types of articles they will accept. For example, for medical literature, you can use Medline or Embase. For evidence-based literature, you can use Cochrane. For nursing literature, you can use CINAHL, which the library does have a subscription to. And for pharmacy, you can use the Iowa Drug Information Service, which the library does not have access to. And then you need to keep in mind that all medical journals are not available in Medline. Medline has its own criteria for acceptance of medical journal articles. Tertiary literature is the most common source of literature. And again, these are your textbooks, your drug databases. The advantages to using tertiary literature is that these sources are generally very convenient and accessible. They're often available online, and the review process has already been done. The disadvantages, it takes time to develop the tertiary resource. They're generally not as complete, and the information is left up to the author's interpretation. Again, tertiary literature includes textbooks, compendia, full-text computer databases, and review articles. Some of the tertiary resources and drug databases that are available to you include AHFS Drug Information, Facts and Comparisons, LexiComp, and Micromedics. Some of the tertiary resources that are available as books include many of the print books, of course, at your library or at the medical library, but also some ebooks. There are several ebooks available through MD Consult, Access Pharmacy, Access Anesthesiology, Pharmacy Library, StatRef, and just by searching ebooks on the Health Science Library site. Another database I like to use for consulting books is this one called Clinical Key, and it used to be under the header of MD Consult. So Clinical Key has an array of medical books. It also has a link to journals, and I also like to use this database for medical guidelines. The monographs here are from Gold Standard, which you may be familiar with because of clinical pharmacology. You also have patient education, multimedia, which is slides and videos for yourself, and continuing education. So let's just browse through the books. So I'm going to click on the books, and you will see that the books are alphabetical. I'm also filtering the books by specialty. Again, they are organized by medical specialty. So one of the books I know that's in here that I may go to the system to use is the Harriet Lane Handbook. So I would type in Harriet Lane and hit enter. You'll notice I get two choices, the Harriet Lane Handbook and the Harriet Lane Handbook for Pediatric Antimicrobial Therapy. If I click on the Harriet Lane Handbook, it will bring up an electronic version of the handbook. And if you don't know, Harriet Lane Handbook is published by Johns Hopkins Hospital, and it is a monolith drug therapy for use in pediatrics and the neonate patients. So I'm generally looking under formulary items, which starts here, but it does give you a lot of information about practice in the pediatric and neonatal population. Another book I like, again, if I want to go back, I have to go books, and then I would type in, is the Myler series, MYLER''S. And I know that the Myler series is for adverse drug events. And it's called Myler's Side Effect of Drugs. So if I type in side effect, I will get them up here under the books and journals. Myler's Side Effect of Antimicrobial Drugs, Cardiovascular Drugs, Myler's Side Effect of Anesthesia Drugs, Herbal Medicines. And I can just pull up the first one, Antimicrobial Side Effects. So I will get up the book, an electronic version again. And this series of books, the Myler's series, provides more information, and it also summarizes the information from the primary literature. You can certainly, I would expect you to look in your tertiary resources for adverse event data, and then go to the primary literature. But before going to the primary literature, I may want to look at Myler's Side Effect of Drugs. It provides you with a nice overview of the drugs and provides case reports. But keep in mind, again, this is a book, and it was, I believe, copyrighted in 2010. So the data in this book is going to be earlier than 2010. The last thing I'd like to show you here is the guidelines section. Again, if I just choose guidelines, and then they're organized by specialty and authoring organization. So if I click under specialty, and if I want to put in pediatrics, you will see that quite a few come up. I have the American Academy of Neurology, Registered Nurses Association of Ontario, the CDC. So, and I can also filter by title. So if I was interested in breastfeeding, I could just type in breastfeeding, and it will search pediatric guidelines for the word breastfeeding. And you see there's a handful that come up. So I do like the guidelines in this section, Clinical Key. Another resource I use for books is Access Pharmacy. Access Pharmacy is a database from McGraw-Hill, and it has textbooks specific to pharmacy. If I go down to the bottom here, you can see an easy site map to this site in which the term drug allergy is mentioned. And you can see here the first one is from pharmacotherapy. This is from DePiro's Pharmacotherapy, a pathophysiologic approach, in which the chapter is allergic and pseudoallergic drug reactions. I encourage all of you to get in these databases, to know what's here, so you can efficiently answer your drug questions. So I was just going to click on the title, Treatment of Adult Still's Disease. So as you can see, on the left-hand side is an outline of the chapter for treatment of adult Still's disease. And you can scroll down and see that these documents are paragraph form. They're highly referenced. Oftentimes I want to print them, so I just come over here and click the print button. You can save to a PDF, Make sure you get your references. So this is their print format, and you'll see at the end here, we'll get all their references and any charts and tables. So I highly recommend you use UpToDate for any type of clinical question that is directed toward evidence-based medicine and is not necessarily specific to one drug. That's when I would use UpToDate. Again, I'm just hitting my back button because the log out didn't allow me to come back to the home page. Dynamed is another resource I like under clinical tools. I particularly like Dynamed for its guidelines. So again, I can type in Still's disease, and I get a monograph, which is a disease monograph on Still's disease, and I see that it's under juvenile idiopathic arthritis. But all of their monographs have a header called Guidelines and Resources, and I particularly like this section because it will provide you with current guidelines, United States guidelines, and these guidelines are divided by country. So I know we have some Canadian students. We also have some international students that will be with us. So I do like this guideline section. You can see United States guidelines, United Kingdom guidelines, European guidelines, and then after the guidelines are review articles. So if you wanted to have a review article on a certain disease state, I would definitely search PubMed, but I'd also consider coming to Dynamed. So again, for these guidelines, you can just click on the hyperlink and it should bring you to the guidelines. If it doesn't, you can find that article in PubMed. But each of these monographs are organized the same way: general information, causes, risk factors, history, diagnosis, treatment. I'll just click on treatment to show you. You can see right off the bat, Dynamed is written in short phrases. It doesn't provide you sentences and paragraphs with the information. It is highly referenced. Okay. It also has evidence ratings for the data and recommendations made. Again, I encourage you to get in here and take a look at these databases. I didn't mention before, but all these databases have extra features. For example, here's some calculators. One thing I like about Dynamed is the statistical calculators, which maybe you'll use in your literature evaluation section. They also have decision trees, clinical criteria. You can get Dynamed mobile and also UpToDate. Directions are on the library site. But I strongly suggest you just play around in these databases and become comfortable with the information that you have access to. We also have access to the herbal therapies. Natural medicines is right here. Again, this database is all about natural medicines. It's highly referenced. Very good source. It has a nice drug interaction, natural product checker, whether or not it's effective. Again, I highly suggest you get in here and use this. All these sources you have available to you. Now, there are specific databases available to the School of Pharmacy. Again, I mentioned the drug database is AHFS. You can find that in the StatRef section. Also, Facts and Comparisons, Lexicon, and Micromedics. The other two databases you'll be using a lot are UpToDate and Dynamed. Now, the drug databases, AHFS, Facts, Lexicon, and Micromedics, are all organized in drug monographs. Each monographs have specific headers that provide specific information about the medications. Now, Micromedics has a lot of components in it. It has drug decks, which contains the drug point summary and the detailed drug information. Also a product index. You have drug interactions, poison index, identidex, disease dex, the AltMed dex system. You have Trissels too. You also have access to Martindale's, the extra pharmacopoeia from Britain. You have care notes, patient information sheets, repo risk system, Shepherd's catalog, which are specific to use of drugs in pregnancy and lactation. You have Lab Advisor, the Red Book, which for cost, average wholesale price, Index Nominum for usual chemical names for all medications, and then material data safety sheets, and you have access to Neofax. So let's take a few minutes and take a look at Micromedics. To Micromedics, you enter the library system, and it's under the pharmacy section, Micromedics. Hopefully all of you are familiar with Micromedics and have used it before. Some of you may not be familiar with the Neofax, which the University of Colorado subscribes to. But I suggest you get in here and learn how to use these databases effectively. I'm going to show you a few highlights about Micromedics that you may or may not have been familiar with. So let's just type in lisinopril. So what comes up is what Micromedics calls the dashboard. So you can see here we have Micromedics summary information. We have a product lookup for toxicology, Martindale's, the Red Book online for wholesale price NDC numbers. We also have drug consults. These are specific questions that are answered regarding the medication you typed in. So this first one here you can see is ACE inhibitor induced acute renal failure. So that will be a summary of ACE inhibitor induced renal failure and the data to support it. You can do comparative efficacy with other medications. Martindale's, you can get the chapter comes under this drug, comes under cardiovascular drugs. So again, you can have Martindale's specific to lisinopril, Index Nom specific to lisinopril, consumer drug information, and drug tools will allow you to have side-by-side comparisons of lisinopril with other medications. At the bottom, you have toxicology exposures related. So in Poison Dex, this is under the monograph ACE inhibitors. You have disease information in Disease Dex. Lisinopril is mentioned in the following monographs: acute MI, cardiomyopathy, etc. Lab information. Lisinopril is specifically mentioned in these labs to consider. And then lastly, reproductive risk information. You have a monograph in Reprotox, Shepherd's, and Tetris. So let's go back up again to the drug summary information. I strongly recommend you use the detailed drug document. The drug summary is just brief information if you're in a rush and really need to know quickly what the dose is for a certain indication or specific adverse events. It doesn't give you much detail. So I generally find myself going to the View Detailed Document. And I would like to show you a few places in this document. Therapeutic uses under clinical applications. You will get a listing of all FDA approved and non-FDA approved uses in which lisinopril has been used. Micromedics has their own rating system for each use. So you can see here the uses, the indications. You can see for acute MI, it is FDA labeled. That provides you approval in adults. In pediatric, no. It tells you that the evidence supports its being efficacious. You then get a summary of lisinopril in acute MI. It will list those consults specific to that topic. And then it's going to give you a summary of the primary literature. So this is what Micromedics is known for. It's what sets it apart from the other drug databases. This right here, little b, is a summary of this article, number 40. The effects of lisinopril and transdermal nitrate together at 6-week mortality. I used to write for Micromedics before I came over to teaching. So all of these reviews are evidence-based, they're non-biased, and again, they're summary of the primary literature. The other section I like here is this place in therapy. That will tell you how lisinopril fits within the class of drugs to treatment of certain diseases, so like hypertension or congestive heart failure. Lastly, I recommend to my students to display the entire document if you're searching for something specific. And then you do your Control F. I hope everyone knows on their keyboard that Control F is the find function. And you can search for specific keywords in that monograph. So for example, if I searched for extemporaneous, I will see that I have an extemporaneous formulation for the oral route. So I have a recipe basically to make a suspension of lisinopril right here. So I do recommend you use your Control F or your find feature in a lot of these monographs when you're looking for a specific topic. The other thing I do want to mention about Tristles IV compatibility in micromedics, you just type in the drug name. So let's see, let's just type in acetaminophen. Now what I want to draw to your attention, many of you may be familiar with this site, but this little icon with the paper here will provide you the product information. This comes in handy when you need to know osmolarity, osmolality, the pH, sodium content, any type of excipient content of a drug, of an IV product. I recommend you go to the IV compatibility product information. Okay, very important. Again, I recommend you get in here and play around with it to become familiar with micromedics. Hi, I'd like to show you now how to use, or a little bit more about, facts and comparisons, which hopefully some of you are familiar with. Again, facts and comparisons will be added to the library site any day now. So at the library site, it's to appear here under clinical tools and also under pharmacy. So again, facts and comparisons is known for their tables and their drug comparisons. And I like you to notice also these interactive tools they have for the drug identification, drug interactions, and drug search by disease and symptoms. This is a very useful tool by disease and symptoms. If you're not sure if a drug could be causing that symptom, you can search here. It also has Tristles. Some other reference information Facts and Comparison has is this Do Not Crush and Chew list. It has immunization resources. The interaction resources is actually drug interaction facts, and it has drug-induced prolongation of QT, look-alike, sound-alike drugs, listing of REMS, normal lab values, off-label drug facts, patient handouts, with a review of natural products, and some toxicology guidelines. So let's just type in enalapril. So again, you see the monograph pop up. You can see up here at the top we have tabs, oral and injection. You also have a speaker here, which if you push, will pronounce the drug name for you.
Enalapril maleate.
It's very important as a pharmacist that we pronounce these names correctly. So again, you can show all by hitting this button here, and that will expand all the sections below. And here's one of the charts Facts is known for. So again, this just gives you product name, the labeler, the route, dosage form, and the strengths. So when I clicked on the product name, it brings me to another screen which will provide more detailed information about the product. For example, the colors, the imprints, and other information. So again, the monograph sections are very similar. Facts has added a clinical evidence section where it is comparing the efficacy with other drugs in the class. So here is actually enalapril with using it for chronic stable heart disease, and here is angiotensin enzyme inhibitors and a drug class summary and a comparative summary, meaning comparing it with other ACE inhibitors. So again, I do suggest you get in here and take a look at what's available to you. Now if I click back one file to the angiotensin converting enzyme inhibitors, I get a class document, angiotensin converting enzyme inhibitors, and this will compare all of the angiotensin converting enzyme inhibitors. Again, this facts and comparison is known for these drug charts that compares, and it's a very good source if you ever wanted to compare drugs within one class. And these buttons at the top right are the same that were the home screen on the left. So if you hit the home button, those buttons are now over here. Okay, let's go ahead now and shift gears and go to Lexicomp. Wohlers Clorter, who owns Facts and Comparisons, bought Lexicomp. So these are owned now by the same company. So you may start seeing similarities. See, as you notice already on Lexicomp, you see a Facts and Comparisons button. Okay. So again, let's just type in enalapril. One thing I want to point out in Lexicomp is they have different drug handbooks. You have Lexi Drugs, you have Pediatric and Neonatal Lexi Drugs, you have AHFS Essentials, which is the shortened or summary information. You have AHFS drug information. Remember where we saw the red book in StatRef? Well, this is the same information here. You have geriatric Lexi drugs. You have pharmacogenomics. Then you have some patient information, adult and child. Lexi Tox, toxicology information, and drug allergy and idiosyncratic reactions and pregnancy. And I put in enalapril, and now I'll just pull up the information from Lexi Drugs. So again, you can see for the monographs are organized, and over here on the left is the outline of the monographs. So I would strongly suggest again getting in here and taking a look at it. I think most of you may be familiar with Lexicomp. Lexicomp does have Canadian brand names also. They do have international brand names for a few of the international drugs. So I just clicked on preparations. So again, it tells you some of the excipient information. And again, one of the best places for excipient information is the product labeling, which I suggest going to dailymed.gov, which we'll look at in a later lesson. So one thing about Lexicomp with renal dosing and hepatic dosing, they have calculators right in the monograph. So you could see here that enalapril should be adjusted when creatinine clearance is less than 30 mils per minute. And if you scroll down, you see all these other calculators that are available to you. I suggest all my students to use the calculators provided by these drug databases. That's why they're there. As in facts and comparisons, where we could search by symptom, you really can't exactly do that in lexicon, but what I do like to do is limit the search, and you can limit it to adverse reaction or contraindication. Of course, sometimes an adverse reaction may or may not be a contraindication, and vice versa. So what I generally like to do is this all text feature at the bottom. So I'm limiting my search to all text. But what I want to show you now is the all text field. I like to use this searching technique when I search for specific adverse events in particular. So for example, if I want to search for yellow vision, a patient comes in, he's on several medications, he's complaining of yellow vision. I know in Lexicomp I have that disease symptom checker. In Lexicomp, in facts, in Lexicomp I can do the search the all text. And I can see that 2 drugs have been have yellow vision in the monograph. So again, I would use my Control F, and I would get up my Finder field, and I type in yellow, and it brings me right to where it says yellow vision. So don't forget, in Lexicomp you can limit your search to these different categories, or also to the all text field. Lexicomp also has other clinical tools, website searches, indexes, and other clinical links. So under other clinical links, you can see I get information on drug shortages, the Institute for Safe Medication Practices, Orange Book, FDA recalls, and they also added some Canadian information here, ISMP Canada, Health Canada, natural products. So again, don't forget these databases have unique features to them, and I would strongly suggest you use them. Okay, so for your homework, I'd like you to answer 3 drug information questions. The intent is for you to get into the library and use those resources that we reviewed today. I'd also like you to answer these using the standard drug information form. And also, I would like you to participate in a threaded discussion forum. Next week, we will review the systematic approach to answering drug information questions. And lastly, if you have any questions as you are going through this material, please do not hesitate to contact me via email through the Canvas site. Take care.